Are you on Medicare Advantage and could you use some guidance on what company to buy based on the brand names that are out there? Hi, I'm Tommy at medicalinsurancetoday.com. So long form video on Medicare Advantage and brand names. So in the Medicare Advantage plan market in California, you have a very competitive market here. Most plans will have a 0 monthly premium, and they're all very, very competitive if you put the plans side by side. There is no way around it. The plans are extremely competitive on the math, but there are a couple that stand above the rest, and I like to say the cream of the crop, and I want to talk about those today and give some value behind these big brand names that we're offering here at Medical Insurance Today. So number one, if you're in Medicare Advantage and you're comfortable in the HMO model, is going to be Scan. So I wanted to talk about Scan today specifically because I love the company Scan. Behind Scan would be UnitedHealthcare, Anthem, Blue Cross, and Aetna. That's kind of the first four that we'll talk to most of our customers about. If you're in the HMO model though, in California, there is no better plan. You know, as agents, we're not supposed to use the words better and best and tops. But you know, there's distinctly plans that are more competitive than others. And mathematically, when you look at it, what's being offered, it's hard to really argue against what Scan does. They have the lowest out-of-pocket expenses compared to the rest of the market. They're at the top there in terms of what your cost will be. You know, with Scan, you pay zero out-of-pocket for the doctor and zero for surgeries and zero for hospital stays and zero for your diagnostic testing and labs and x-rays. Including prescription coverage. You know, there's an outline, you know, that we go over in detail with all of those. Now, all of the plans, if you put them side by side, are going to be very near to each other, but Scan is the lower of all those names that I have put out there. Secondly, Scan, when you call them, they are very, very good on the phone. They're, you know, you're not going to sit on hold for 15 minutes to get customer service with Scan. And generally, the people you talk to at Scan are going to be very, very pleasant to work with. I have family members on Scan. If I was going into Medicare, I would go on a Scan myself. And the big reason is, you know, being a high volume agency, you know, we help a lot of people. We help hundreds and hundreds and hundreds of people a year. And, you know, there's a lot of customer service that goes on with going into healthcare, with the moving pieces and the confusion and the costs related to healthcare. You know, our phone rings a lot. And one of the biggest values for Scan, other than, you know, they're great in terms of their numbers and their customer service, when I put people on Scan, I don't ever hear back from them with problems. And that is a huge value as an insurance agent, because when you're selling insurance, you're always hearing from folks saying, well, I got this issue with this company. And Scan is no angel, you know, they're an insurance company. But when you are with an insurance company and you don't pay anything when you go and use most of your services generally, and you got very low copays on your prescriptions, and it includes dental, vision, hearing, and a gym membership, and you get free money for over-the-counter benefits to buy every year, or quarterly, I should say. It brings great comfort to an agent to say, yeah, when they go on a Scan, they're going to have a good experience. And I can testify to that. And I wanted to give them a lot of love in this video, not just a little bit. Behind them, though, UnitedHealthcare, Anthem, and Aetna are great companies. They're bigger brand name companies. And in my personal experience with, you know, dealing with all kinds of businesses, and especially with insurance, is, you know, will the customer have a good experience? Are they going to get what they need? Are their claims going to be covered? Are they going to, you know, what are the expenses related to the plan? And as many people will know, if you watch my videos and if you're in Medicare, you know that you don't pay very much for your services as it is. Medicare is great. It covers more. It's less expensive than plans before you turn 65 or go in the senior market. And Medicare is awesome. But when you deal with a bigger brand name company like a United, which is how I built my business, was through UnitedHealthcare, back starting in 2010, and you know, Anthem, Blue Cross, and Aetna, when you're working with those bigger companies, they are going to have that brand name recognition that people really like. They're not bad by any means, but generally you're going to sit on hold a little longer to get on the phone with them. Generally, you're going to have to deal with you know, potential claims issues, and I just seem to get more calls about those bigger brand name companies of people having issues with them and not getting the customer service they need, not feeling like they get heard. And I can just testify, and that's the real point of this video, was that with Scan, if you're in the Medicare Advantage plan market and you're comfortable on an HMO, Scan is probably going to be your best bet in Southern California and a number of other regions. So they've started to expand into other states, Scan has, but only in small pockets, only where there's, you know, generally big metropolitan areas. They're really dominant in Southern California, across LA and Orange County specifically. That's where most of our market is. Scan's exceptional. And if you're in the Medicare Advantage plan market, there's been a bunch of shifts. So part of this video is to talk to people about, well, you should be looking at your plan because the shift that has happened with many of these companies has raised copays, changed how prescription coverage works, lowered the dental and vision benefits. So oftentimes benefits will start to diminish as you see year-over-year changes, and every year scan has just improved their benefits. I can testify to that. I believe it's going on 8, if not 9 years now. I should know that, but I believe it's 8 or 9 that I've been selling them, and they just keep getting better and better. So if you need some validation to companies and you're looking for what are going to be at the top and the type of companies you want to look into, for us here at Medical Insurance Today, and we have a number of other companies behind these, but again, Scan, United, Anthem, and Aetna in the Medicare Advantage plan market. We also represent Aetna and Humana and a string of others. But if you could use some guidance, please reach out to us. This is my long form video for anybody that's still listening. Reach out to us at medicalinsurancetoday.com, and we look forward to serving you.